Hello and welcome to EMS Research with Professor Bram, where we talk about the research-related issues that matter to those who work in emergency medical services. Today we'll be talking about research related to fatigue and how it applies to EMS, so stay tuned for the interview. My name is Bram Duffy. I'm a research fellow with the Institute for Social Innovation at Fielding Graduate University. I've also taught over 60 college-level classes in areas like communication, leadership, and EMS. And my own research is in the area of how paramedics communicate. So I look forward to reaching out to like-minded people. I actually have a research study open now for paramedics. So if you don't mind being interviewed by me, then you can go to my website at professorbram.com, click on the current research tab, and check it out if you want to apply. You know, in essence, the work that we do with this podcast and vlog is all about discovery and learning. We want to aim to equip you with invaluable knowledge, especially because EMS research data is elusive and not easy to get behind paid walls and subscription barriers. But what we can do together is look at scholarly, peer-reviewed articles and deep research. So I look forward to embarking on this with you together. It doesn't matter if you're a doctor, nurse, paramedic, firefighter, or a researcher yourself. This is an episode and a vlog podcast made for you. Before we get started, I want to share that I've written 2 books on communication. The most recent book has just been released called Hypnotic Communication in Emergency Medical Settings for Life-Saving and Therapeutic Outcomes. You can find a link to the book below, and also for sure hang out near the end and I'll tell you more about it. So today I'm here and excited to be able to interview Matthew McElhenie, who is the general manager at Cambria Community Services District. He's also has a background as a firefighter, paramedic, and EMS instructor. He has a doctorate in public administration, and he did his dissertation research on fatigue in the private ambulance workforce. So I'm happy to have you here. Dr. McElhenie, tell me about yourself more than I could just now.
No, yeah, thank you. Thank you for having me, Bram. Well, like you, I've worked in the field between the private ambulance sector, even some public sector ambulances, and then the fire service for roughly the past 15, 16 years. My journey has been unique. I thought I was going to be a career firefighter and climb the ladder into, battalion chief, unit chief, managing a large fire department. I suffered a couple knee injuries while I was in the fire service, and it started bringing to light that our careers can be finite. So I really started working on some of my graduate work in public administration, specifically public safety administration, master's degree, and then I started my doctorate. And in that transition of starting that educational journey, I had the opportunity to work at a community college in California, and I applied for the position. And before you know it, I was hired and had to make a decision whether or not to leave the fire service or head into or stay in the fire service or head into academia. And so the fire service and EMS in general can be rough on family life. I have a wife, 4 kids, and I was spending a lot of time, especially in California, on large incidents for the fire department, that 2 weeks, 3 weeks, 4 weeks. And so I took the leap, went into education, and I've been teaching at a community college for the last 6.5 years between teaching paramedics and EMTs and even health education courses. I then also had the opportunity with my public administration degree to become the general manager of the district in which I worked as a paramedic 13, 14 years ago. So I kind of climbed the ladder there, and now I'm on another journey, which is running a small community service district that manages a fire department, water, wastewater, lighting, and trash.
So it's because of this.
Thanks for having me.
This background that you have is really awesome, because there's a lot of people who might be thinking about their own future career paths, and the path that you've done has obviously been rewarding. And one of the things that came out of it was this really incredible research that I found. And so today we're going to get to look at more about what you did. And the research work that you did is interesting because it's like this topic that's at the intersection of transportation, healthcare, public safety. And what we're talking about is fatigue in emergency medical services. And So first, let's just to talk about fatigue. It's a major issue in our lives, but also especially in industries like transportation, where it can lead to impaired thinking and slower reaction times, weakened memory. And those impairments aren't just a harm to employees, they can pose significant risk to public safety. And so you might say, oh, well, what's that have to do with ambulance services? But even though ambulances aren't really classified under this transportation industry, they fit all the risk areas, including fatigue. And this is really concerning because fatigue can directly impact patient outcomes. And so this brings to a critical question we have to ask: how are ambulance services managing fatigue risk? The reason this is such a big deal, I think, is because when we look at any time we have to manage something in a way that moves the work into the private sector, it means that there's a profit margin to look at. And sometimes those profit margins are what dictate the business. And as a result, we aren't able to account for things that put providers in harm's way. So maybe the staffing isn't good enough on a particular night. And as a result, then someone literally doesn't sleep for 2 days, and those kinds of things can be scary, especially when provider is in a position where they're like a soldier, at war, dealing with emergencies, and they themselves are not able to think clearly. And the other thing to add, my own concern, is that there are some parts of the country where there just are no paramedic ambulances. And so if you work for a private provider, what if you get stuck knowing that I can't just walk off my job because my private employer treats me bad? I mean, if I walk off the job, my family member may not have an ambulance to call. So there's a lot of intense elements to all of this. And so there's a dissertation that you wrote was called Fatigue Risk Management in Privately Contracted Ambulance Services. And it's a Countermeasures Approach. And the study looked at what tools were being used to monitor fatigue and be able to take care of these folks that were in the field. And this is important because it contributes to our understanding about how public administration works to manage these complex systems. And knowing about fatigue monitoring within these ambulance services can mean the difference between life and death. The EMS administrators have a big responsibility to manage these risks. And I think about how one way that an EMS manager or a city manager might be able to manage the risk is just by hiring a private ambulance company and think, oh, everything's going to be okay because, now this is our backup, or now this is these are the folks that do it every day. But now the concern might move more to how do we make money to do this instead of how do we take care of everyone that needs it. So this topic underscores the real need for effective risk management when it comes to fatigue and ambulance services. And so before I get to a bunch of questions I have for you about this, because this is something that is personal to me because I work on an ambulance and I do 24-hour shifts. I'm thankful that my employer participates in a fatigue management program that allows for downtime, and it's the only reason they're able to is because the system is so large. And if we didn't have a system this large, it wouldn't be possible everywhere. And I've also been an EMS director where I manage large operations, so I know that when emergency calls keep coming in, and you're just stuck with the resources you have sometimes. And of course, no one wants to burn someone into the ground without sleeping for 24 or 48 hours, but it happens. So but before we get to the interview part, I just want to hit our audience with some facts. And the facts that I'm sharing are pretty cool because they're all facts that came out of the literature review for your study. And I was just like, every time I read another page, you're hitting an emergency button, for this information being important. So let me hit you with this. So one study, according to Knuckles, and another study by Pack, it was found that sleep loss and fatigue impaired cognitive function and increased traffic accidents and increased medical errors and decreased productivity. Another study, according to Baldwin, shift work that results in the loss of sleep is linked to increased rates of medical errors in patient care. Another study, according to Rogers, medical errors are 3 times more likely among nurses who have more than a 12.5-hour shift. Another one, a similar study by Dula, looked at critical care nurses who had 2 times the number of critical errors if they worked more than 12 and a half hours. And another study, Weaver, found that there's a significant relationship between hours worked, fatigue, and risk of injury to EMS workers. Another study, Chambers, conducted a study that talks about how the NTSB, the National Transportation Safety Board, identifies fatigue as a factor in more than 1 out of every 5 vehicle accidents that result in injury or death. Another study, the National Safety Council has noted that U.S. drivers are more than 3 times as likely to be in a car crash if fatigued. So all of this stuff is overwhelming when we think about how there can be ambulance workers out there that are confused and behind the wheel and on no sleep. And as someone who does the job myself, I say that, you know, when you're up and moving your body and going, it gets to be really difficult when there is no rest time, there is no break time. And that can mean that you end up at your most vulnerable period around 2 a.m. or something, when the emergencies are still happening and your body is on zero. I'm really thankful that you looked at this topic. Please share with me more about your study and about like the research methodology that went into it, because a lot of folks may not be familiar with how you would have put a study together like this.
So much of what you said just hits the nail on the head, as they say. You know, when you get into your dissertation and formulating, you know, what your topic's going to be, as all doctoral students do, we go into it with this huge, grandiose idea of how we're going to save the world with our dissertation, right? We start very, very large. And so when I initially started my dissertation, I was looking at fatigue, I was looking at PTSD, I was looking at all these subjects because I was really passionate about how I could tie in my focus of public administration into EMS. So I was looking at the fire service, I was looking at, you know, public and private ambulances. I was looking at, you know, everything that encompassed EMS and fatigue. And then I eventually had to whittle it down, right? It had to be a small, you know, start with a smaller scope. And then this was something that maybe somebody else could build upon. So when I really started whittling it down, I started looking at the private sector. And in public administration, we're always trying to create efficiencies. So we will contract out services because it is cheaper for us to contract out certain services, much like trash service or anything else. We'll contract that out, let another company handle it, and pay them a lower fee than it would be to hire city and county staff to do those jobs. Well, that's essentially what we do with EMS, and you see it across the nation. We're contracting out to some of these ambulance companies who then provide the services, and it is at a lower expense to that district, to that public administration or administrator. And so what I really started doing was looking at those privately contracted 911 ambulances. And then I took a lot of research from Dr. Patterson and his colleagues who had come up with evidence-based guidelines for fatigue risk management, specifically in EMS. And I took those guidelines, those various different guidelines, and I took those and I created those as research questions and interview questions for EMS administrators. I then looked at California, a very large state, but we're very fragmented in terms of EMS agencies. We have 33 plus EMS agencies across the state that cover various jurisdictions and areas. Each one of those, for the most part, very few do not contract with a private sector ambulance. So what I did is I went out and I reached out to all 33 EMS administrators and tried to set up an interview and ask these questions about fatigue risk management. You know, are you monitoring or tracking fatigue? You know, are you giving any education to any of your employees about fatigue risk management? Do all of the employees have the ability and to access caffeine? You know, because there's studies, obviously, we know anecdotally, right, as EMS providers, that coffee keeps us moving on long shifts.
Yeah,
you
and
know,
energy
are there
drinks.
areas where, yeah, exactly. You know, are they allowed to take naps on duty? You know, for those who've been in EMS a long time, whether you're working 12 or 24-hour shifts, you know, we've all had the supervisors that'll catch you napping in the middle of the day, and it was frowned upon. It wasn't permissible. It wasn't looked upon as, you know, something that you could do, you know, the safety naps, right?
Yeah.
You call it a safety net, but you would have you had a paradigm out there that wouldn't promote those types of things. So what I did is I went to the administrators that are, they're responsible. They have to be accountable for these contracts that they award to these different ambulance companies. And I asked them those questions. Do you know of? Do you require? What's the max shift length that you allow these crews to work in terms of consecutive hours? And it was pretty alarming, some of the things that how they responded. The other alarming part, which, maybe we'll get to later, is the sheer lack of willing to participate by EMS administrators. I had several that I reached out to in the state of California that just said, no, thanks, I'm not interested in even participating, which I thought was eye-opening.
So do you think that it was because they were afraid that it would shed light on the own problems with the risk in their area and they didn't want that to happen? And that's one of the reasons.
That's my guess. I would, as an EMS professional and someone who works in public administration, anything to
make things better,
provide, to do better, to provide better service, I would think you would be interested in. But, when I asked specifically, this is my topic, fatigue risk management among privately contracted ambulances, and I'd like to interview about it, I got the feeling that they didn't want any aspect of their organization to be exposed for the lack of monitoring.
So out of the 33, what was the percentage you got?
I got 5.
Okay.
5 administrators. And I repeatedly sent email after email. I made phone calls. I did everything I could do to get them to reach out to me. And, this was during COVID. So I imagine some of them were pretty busy, but yeah, 5, I was happy to have 5 actually after about a year of trying to reach out to these agencies.
Well, I know you got good stuff from them. Tell me more about, some of your surprises.
A lot of my surprises were that EMS administrators do not do a very good job of tracking consecutive hours worked.
Mm-hmm.
So 24, 96, some of them did state that, that they'll work 12-hour shifts and that they're supposed to have at least 8 hours off,
mm-hmm.
but they don't account for mandates. And they also don't track that if that mandate pushes them into another shift, that they don't have a way of tracking those mandatory 8 hours off. And the 8 hours off does not account for travel time, just doesn't account for clock in, clock out, for restocking, anything of that nature. So I thought that pretty astonishing that none of the administrators really tracked how many consecutive hours that they're on duty. And you had mentioned it in some of these studies, and there are other studies out there. They say that 24 hours of no sleep equates to about a 0.08 blood alcohol level. And I'm sorry I don't have that study in front of me, but when you think about that, how many intoxicated paramedics and EMTs are out there driving ambulances, because they've worked longer than 24 hours.
And the horrible joke is that it's daylight now, so I'm more awake. You've been able to survive the night shift. You finished the 24. It's now 6 a.m. and you're still going because the sunlight's in your face and you're rejuvenated, and you're not. You're drunk. That's what you're saying. Yeah. Oh, it's so scary. Yeah,
absolutely. It's scary. And then as far as any education in fatigue risk management, there was a lot of responses where they don't know if it's promoted, they don't require it. What I found was that the administrators are totally disconnected from the operations piece.
Mm-hmm.
They have handed it off to that private ambulance company, and they are hoping that company does the right things.
Mm-hmm.
But as far as accountability from the administration perspective, I saw a huge disconnect between what administrators actually know is going on in the field, and what they're doing as administrators to manage it. And even more so, I think perhaps some administrators are just they're more worried about response times.
Yeah.
So are they getting to the call within that 9 minutes? If that's what the response time is in that jurisdiction, they're more concerned about that. They're not concerned about the crews that they're on duty for extended periods of time. And then you take into perspective, a private ambulance company, a lot of their monies are in transfers and things of that nature. So you'll get these long distance transfers out of that jurisdiction that will take an already fatigued unit and send them on a 5-hour drive to a specialty hospital in Northern or Southern California, and then bring them right back into the system. That also takes a unit out of the system and makes these other ambulances just that much more busy. So yeah, all around really surprising in some of the responses.
The aspect to this that I think is most concerning is that sometimes it comes down to a private ambulance company owner on how that's managed, how much resources they're going to allow, and how connected that person is with the operation or not can make a real difference. Because I've been in both types of systems. I've been in a system where I was the director and I only had so many resources, and I've been in other systems where opportunity for wiggle room, and a lot of times it depends on how big the system is and how willing they are to allow for that wiggle room. Tell me what else that you learned that was interesting.
Contractually, so I pulled all the contracts for the various agencies, and so contractual language to actually see if within any of the contracts the administrators required anything that has to do with fatigue risk management for the actual EMTs and paramedics and providers in the field. And I scoured all of the contracts and I found almost nothing except for some language about the maximum amount of hours they could work. And so I found that some areas had no language about the maximum amount of hours they can work consecutively. I found others that would get into the 72-hour range. And these contracts sometimes are carryovers of previous contracts. So when you think about some of these maximum consecutive hours allowed, these hours may be extended back into the 80s, because we're dealing with call volume from the 80s and 90s, that those things just kind of linger in the contracts and are carried forward. I think we all know that our EMS system is that much busier.
Yeah.
That was
one of the things I want to throw out there is that some places are much worse than others. I have this dear friend who's a paramedic EMS educator. His name's Jay Cloud, and he posted something on Facebook a couple of months ago about how he said that he had just verified that an EMS agency 911 provider in somewhere in rural Texas was having their paramedics work for as long as 7 days straight, 7 24-hour shifts straight. And so, I'm not in a position to follow up to find out which agency that is, and if they actually, maybe they do have a plan for sleep and downtime for that person. But what I know is that we're talking about anywhere that's rural is going to have resource limitations. And then to think that one person might be in a position to be working nonstop, and then, gosh, if it's normally busy, that's one thing, but what happens if there's a disaster and then there's no backup to the backup? And so these things are scary to me because I know we have ambulance deserts, and I know that we have parts of the country that are much lower in resource than the areas that you were able to research. Do you have any personal anecdotes yourself about this research, or about how this has touched you? It's a big deal when you take a dissertation takes over your life, and so I know this is you. This is part of you. So I just wanted to ask about how this wrapped up into to make you who you are, and how you look at things different, and just all that perspective stuff.
Yeah, that's a great question, because when you're young, I don't know how you were, Bram, but when I was a young paramedic in EMT, I was trying to raise a family. I'm trying to buy a house. So I loved overtime, but I was young. I was young and I could handle that, and I loved the overtime. I didn't realize how tired I was getting, or, the little mistakes that you make, whether it's not turning your sirens on, or, whatever it may be. Maybe you went too fast through an intersection. I didn't have any real close calls, but as I look back at my younger self in EMS and how much overtime I worked and all the things I would do because I was looking to provide for a family and purchase a house and those types of things. Now, as I'm older and my body just can't do these things anymore, I cannot do these types of shifts that I did as a younger EMT and paramedic. I think about some of the close calls that my colleagues have had. I think about how we as an EMS profession sometimes will stick with an old paradigm, because that's how we provide for our families. This is what we do. We work 72, 96, 7 days a week. We'll do those types of things. We'll get off shift and go take a long distance transfer for some extra money and work 12 hours. I just think it's so bad for us that we just don't realize it yet. And I think we need to have a huge paradigm shift in this profession for our own safety. I think anecdotally, talking to a lot of my colleagues, they've had those shifts where they worked 24 hours straight with no sleep and then were sent on a 5-hour long distance transfer. And then they did get in an accident, right? Or they did hit something, or it scraped up the side of the ambulance, or they had a near miss. The other piece of it is that I think is really missing, that is going to take a huge paradigm shift in its own right, is how many medical errors are actually happening on the ambulance due to fatigue, but they're kind of hidden from the public, right? They're stuck in the QA process,
right,
within the organization. It never reaches the administrators of the system.
Mm-hmm.
We never tie those mistakes to fatigue. And that's the research I would love to see happen. But I'm so skeptical, because are those private ambulances ever going to open up their books and actually do studies and have an open dialogue with their county administrators, with their medical directors, to say, look, these are all of our medical errors over the past year. These are the amount of hours that those EMTs and paramedics were working prior to that error. And we believe that this error is tied to fatigue. And there are no studies out there in the private sector.
All this list of studies that I was able to read from were cited by your dissertation are big whammies. I mean, those alone should be able to get us there. And I want to mention another angle to this is that sometimes cities work too hard, or municipality, or the 911 provider works too hard at the risk management of sleep. And just to mention, I worked for a fire department as a paramedic, and it was really far from my house, but I really loved everything about the city and the situation, and I thought maybe I'll move there someday, right? And so because of that, I went to work at a job that, because of hard traffic and stuff, it could have been an hour and a half sometimes was traffic. Okay, so traffic's not that big of a deal if you do long shifts, because you think, well, I just go once. But what happened to me was that this place that I worked was so strict about risk management for sleep that they only allowed 12-hour shifts, and then the 12-hour shifts that they assigned were done in a rotation format, so that you were on this pattern of sleep, awake, sleep, or whatever it was, but they basically dictated your awake and sleep routine. So what happened to me was that I'd done at that point, a long career of being used to working 24-hour shifts, but now I was doing an hour and a half drive to and from work, and then doing a 12-hour shift, which was not, which was all go and no sleep. And it totally exhausted me. I absolutely was not able to function or think straight or work right. And it's because I couldn't get my sleep pattern ever to work right in that kind of condition. And that's the exact reason why I didn't make it there, was because I was like, well, I just can't, I felt like a zombie. And to think that people go through that with 2 full-time jobs, or, crazy amounts of sleep deprivation, I guess I'm thinking that all the evidence is here. It's just a campaign effort of push that needs to be. And one of the things that I've seen in my own career is a concern by ambulance owners and EMS administrators for big publicity about anything, right? Because if there's an ambulance wreck, then of course there's an investigation, but I don't know what you would say. I would say there's a good portion of ambulance wrecks that are directly connected to fatigue. We know it because we've done the job. It's something that I think is going to take a campaign. When reflecting on all this, what thoughts do you have that maybe we haven't got to talk about yet? Do you have any thoughts about how to make things better, or maybe any other insightful things to kick out there?
Yeah, for myself, I really think that this really has to happen as like a governmental move, right? So being, with my background in public administration, something has to happen at the local, the county, the state, the federal level to really take a look at this in terms of monitoring fatigue. Going back to some of those studies, when we look about transportation, air, even some of our long haul truck drivers, they're all regulated in terms of the amount of hours that they can work straight and drive these vehicles. And I just find it astonishing that at the local, state, and federal level, we are not looking at ambulances in the same fashion. I have a colleague that brought me into the education side, and he's a pilot. Strict requirements on what he can do and cannot do in terms of sleep and fly an airplane. The same thing goes with Amtrak. I mean, you name it. And they have a ton of restrictions on there. Even physician residencies are getting stricter in terms of how long they can be up. And they have to have an ability, a room set aside for them to sleep if they're still on duty. We do none of that, in EMS. We really are not regulating it from a government level. And while it would be nice to think that at the private sector, they'll start doing some of these things on their own, I think we have to, from a legislative end, start looking at monitoring and tracking sleep and consecutive hours of work in our EMS professionals that are driving ambulances, both public and private.
I think it's the only way that things got fixed in the other way. Like the only reason that the transportation industry and otherwise is being regulated is because of government. So you're saying that's what's going to do it for this too.
Yeah, and all of those are consequences of bad outcomes. It wasn't the government that said, okay, this sounds like a good idea. It was a massive train derailment. It was a tour bus crash. It was things like that trigger legislation. And so I'm hoping we don't have to have something like that, unfortunately, in the ambulance world to happen for us to take action like that. But that's what I really think needs to happen, is we need to look at it from a governmental, legislative.
And it's scary because I'm here to tell you and to tell the audience that I have had friends and I've had coworkers who are dead, and it's because of an ambulance wreck. And I can't say, oh yeah, they were tired for sure. I know they were. I know them personally. I know what they did in their life to provide for their family. I know the kind of, schedule and work hours. And we talk about this. It's sort of like from a perspective of, oh, there's this research study, but I mean, it's for sure people die, and it's so scary. Yeah. And I know that I'm in a high risk field because of it. And I do things that are wild and crazy to make sure that my partner and I can, maintain readiness. It's also what I would assume to be another big contributor to the burnout in the industry that everyone talks about and knows about. And then with that comes the other pieces, like the mental health pieces and the other components that we have found are all things that are done to soldiers. Well, Matthew McElhenie, I want to thank you so much for being here. You're awesome to be on this topic, and I appreciate the work that you do. Now, I want to also invite you to check out my latest book. It was already rated as Amazon's #1 release in the emergency medicine category. I co-authored the book with 4 Arrows, who has 2 doctorates and is an expert on indigenous scholarship and hypnosis. So I just want you to get the invitation to check it out, because we introduce a method for communicating with patients on the scene of an emergency that really works to take advantage of the properties found in hypnosis. And this book works to change the way we approach and interact with patients on an emergency scene. So the book's called Hypnotic Communication in Emergency Medical Settings for Life-Saving and Therapeutic Outcomes. You can follow the link below to find it, or go to almost anywhere that books are sold. I'm doing a research project related to paramedics who live in the United States, and I could use your help. So if you don't mind being interviewed over a video call, go to my website and fill out the form at professorbram.com, and I'll be able to get in touch with you. Thanks again for listening. I look forward to sharing more insights with you on this next episode. So if you enjoy the EMS research, please tell your friends, like, share, and subscribe to get the others to get the message. And then hang out and you get the references at the end.